The Ministry of Education has attributed the delay in releasing the money to cushion Board of Management teachers to incidents where non-teachers were factored in the list of payment. Education CS George Magoha says that the money will only be paid to BOM teachers who are physically in schools. Magoha, who was speaking in Bungoma County, where he had gone to assess the level of preparedness ahead of reopening of schools, said that the ministry was in the process of scrutinizing the list to ensure that only genuine teachers benefit. Magoha at the same time has challenged parents to chip in and assist government in construction of more classrooms to accommodate the high numbers and adhere to COVID-19 protocols when schools resume.
When we see discordant lists, this one is saying 20, this one is saying 30. Do you want me to go and confirm that there are 22 and not 30? It was due diligence. It has since been done, and the money will hit the accounts anytime. Then the money is hitting the accounts for human beings who are there.
Elsewhere, Kenyan journalist Yasin Juma has been released from an Ethiopian police cell 50 days after he was detained. According to a statement by the Foreign Affairs Ministry, Yasin, who had earlier in the week pleaded with the Ethiopian government to set him free, is currently in isolation at a state-run facility as he had tested positive for coronavirus. The journalist was released after Ethiopian Attorney General said he was detained wrongfully because of language barrier. And finally, Nairobi, Juliet Gikonyo Nyaga is now the new CEO of the Karen Hospital after she took over from Dr. Betty Gikonyo at a ceremony attended by Cabinet Secretary Raphael Tuju. Dr. Betty Gikonyo, who has served in that capacity for a period of 15 years, will now take up the role of chairperson of the Karen Hospital Board. Juliet, who has previously held managerial positions at the hospital, has promised to improve service delivery.
The level of professionalism here and the level of nursing care in this place, I'm able to confidently say that it did not only measure up to what I encountered in the top hospitals in London. You are better.
We support the work of government in training the much required capacity building in workforce in health. And we also save the government foreign exchange when patients travel abroad, when we do their treatment locally. Maybe it's time that the government considered some tax incentives.